And your diagnostic block, you get a medial branch block, that all showed the same thing. Is it all consistent? That's a better question.
Yes, it all pointed to the same thing. Her exam, her diagnostic response to the procedure, her therapeutic response to the neuroablation procedure, because she got long-term relief with the procedure to block the nerve to the joint. The x-rays, MRI, everything fit together perfectly.
All right. And the lack of the C3-4 problem on the x-ray 3 days afterwards.
Yeah, that's fairly telling because, again, that just proves that she had post-traumatic arthritis that would develop in a time frame of 3 to 4 months, and that would not be related to normal degenerative change, because that usually takes years to occur.
I got you. Now, okay, now we're going to go back a little time, and I appreciate we're now going to go back to November 21st, 2013. You've done the medial branch block on November 1st, 2013. She comes back to see you on November 21st, 2013. And what did you learn at that time?
Well, at that point, she told me she got an excellent diagnostic response. She was pain-free for several days, but her pain came back, which is typically what we see. So at that point, I had recommended that we do a more long-lasting procedure that would give her more long-lasting relief, and that's where we do a neuroablation procedure. It's very similar to the procedure I showed you, where we block the nerve, but instead of just putting a needle in there and putting numbing medicine in there, we actually put a needle that has a little heating probe at the end of it, and we cauterize the nerve. So we basically heat the nerve to kill the nerve. And so it basically cuts off the sensory nerve to the joint, so the patient doesn't feel the joint. So that's a great procedure, and especially when you get such a strong diagnostic response and we can confirm that the pain is coming from that joint. We do this procedure where we can cauterize the sensory nerve that goes to the joint, and that can give people relatively long-term relief of their pain. And so she was an excellent candidate for that. I explained it to her, and she wanted to proceed with that procedure.
Okay, and did she go through the neuroablation, or what I call a rhizotomy, on December 20th, 2013?
That's correct, she did.
Those are the same terms, neuroablation,
yes,
rhizotomy?
Yes, that's the same thing.
Okay. And before we talked about injections, I used the term diagnostic. That's the ones that don't help you, but other than you diagnose the problem, right?
That's correct.
The other kinds of injections that actually can provide long-term relief are called therapeutic injections.
Right. The medial branch blocks, as I testified to, you use a short-acting anesthetic. It doesn't last very long. It wears off. The neuroablation, where you cauterize the nerve and kill the sensory nerve to the joint, that's a therapeutic procedure where the intent is to give long-term relief.
And you do that on the left side of those?
If all of her symptoms were pretty much, the main problem was that left upper neck area that related to that joint injury.
Okay, after you did the rhizotomy on December 20th, 2013, she came back to see you on January 2nd, 2014, right?
Yes.
And what did she report to you what did she tell you? How was she doing as a result of the rhizotomy or the neuroablation?
Well, she was doing dramatically better. She stated 90% improvement at that time. The only pain that she was experiencing was hypersensitivity in the region, and that's very common because when you cauterize the nerve, you get a little bit of what we call neuropathic pain, because when you kill the nerve, it does cause some burning sensation and hypersensitivity that can last 3 to 4 weeks. Sometimes we have to medicate people for that. But that's a very common thing that we see. It always wears off, but we do have a period of 3 to 4 weeks where they have that hypersensitivity, and that actually proves to me we're in the right spot, because when we get that hypersensitivity, then I know that I got the nerve. And then, so that was pretty typical, but for the most part, she was doing very well.
Now, actually, then you saw her a few weeks later on January 27th, 2014. I'll just put there.
What date?
January 27th, 2014. This will be your second visit post-rhizotomy.
January 2nd, yes. Were you saying January 2nd?
Actually, I said January 27th. We talked about the January 2nd visit.
No, I don't have the next date that I
The reason I
have.
even asked you that is that's what Mr. Morrell, is it linked?
Yeah, it is.
I have 223 as the next, oh, wait. You could look at these records, and it's not in order if it's not here, because I have January 2nd.
That's your first visit after the resolve. She's
Yes.
90% approved, right?
Yes.
And then I see that my record showed you saw her 2 weeks
Here,
later.
Paul, can you look at this here? See,
I think they're out of order in the exhibit.
yeah, because I don't see it on the next thing here.
Well, let me-
It's out of order.
We might have got not put in, looks like. They're not in there right now.
Okay.
It's okay.
But you saw her a few weeks after that.
Yes, if you, I don't have the record right in front of me, but I did see her on a regular basis after that procedure, yes.
And after you saw her, was she even more improved, 95%?
Yes, yes, she kept on getting better to the point that she was essentially 100% better.
Okay. Now, and as, I know that's a therapeutic thing, but does that confirm your diagnosis that you've got the right problem?
Yes, I think everything fit perfectly because she got a good diagnostic response to the medial branch block. She got a good therapeutic response to the neuroablation procedure. So it did confirm to me that that was what the problem was.